all the advanced Western medicine treatments didn't help her. So my mom now is 81 years old, and she doesn't have any diabetes, and she's not on any medication. Tend your body like a garden. Because in Western medicine, we look at human body as a machine. And I really want to live to whatever age my body allows.
Dr. Yi Song, raised in Beijing in a 17-generation medical family, trained in pathology at Brown University before focusing on regenerative and holistic healing. She's operated a holistic clinic in Boston since 2004 and founded the Zenerchi retreat in Colombia in 2018, where she offers advanced stem cell therapies. Integrating stem cell therapy, traditional Chinese medicine, and anti-aging treatments, Dr. Song aims to help people live longer, healthier lives. Dr. Song, welcome to the show.
Thank you very much for the introduction. And I'm very happy to be here to share the ancient wisdom and the modern technology, how we can help everybody live healthier and longer.
Amazing. Well, I want to start off because I know my listeners and viewers love hearing about the background. Well, obviously, you've got 17 generations, right? So was that the driver for you to really get into TCM and dig into that in the beginning? Or was there something more personal in the background that brought you to that?
See, actually, one was maybe around 6 years old. I was always interested in learning about the mechanism of human body. But at that time, I thought Western medicine, Western science was more advanced than traditional Chinese medicine theories, even though I did grow up with a lot of traditional Chinese medicine in my family. Then, and I witnessed my grandmother who had type 2 diabetes for the last 40 years of her life. And she didn't take care of herself properly because she was working very hard, even when she was already having very severe symptoms of type 2 diabetes back then. And she basically developed a lot of complications from the diabetes. And when I was born, she was already almost blind. But then she did raise me when my parents were not in Beijing because of Cultural Revolution. So when she passed away, I was around 15 years old, and she suffered a lot for a long time. And she actually was not in the Chinese medicine field. She was always in Western medicine field. So I witnessed the kind of suffering she went through with all the advanced Western medicine treatments and didn't help her. So that's when I started thinking, I think there may be something else that we need to also look into how to address these issues of aging and aging-related conditions. So at that time, I was also influenced by my older aunt, my mother's older sister. She was totally into traditional Chinese medicine, influenced by my great-grandfather, studied with many different Chinese medicine masters, and she introduced a lot of Qigong master in our family. I even practiced Qigong with the masters. So that's how I also got that side of introduction earlier in my study, in my earlier childhood, about how these theories in Chinese medicine really also attracted me. But still, at the back of my mind, I was still thinking Western medicine should be more advanced because it was developed in the past 100 years. So that's why I studied Western medicine initially. And then after studying into already graduate study, then I realized this really now helping people. And I myself also suffered from certain digestive system weakness and then also acne when I was in my 20s. And I had to go into my Chinese medicine route to solve my own health problem. So that's also when I started thinking we really need to look into the Chinese medicine theories developed in the past 5,000, 6,000 years because they were tested in the long history and then by so many practitioners. And then that theory is mostly looking at things in a totally different way from Western medicine. And that's why it actually has deeper philosophical, metaphysical approaches than the Western medicine, only looking at molecules and cells under microscope, and it's losing the whole picture. So that's how I switched, and then and then gradually I actually realized now, if you ask me, I really think most 99.9% of conditions nowadays people suffer. You actually, most times you can, if you understand the principles of Chinese medicine, you don't need to resort to medications or surgeries, because the holistic approach, like mentioned in the 6 principles in my upcoming book, if you really practice those principles, you can have a very healthy, long life without suffering from all these degenerative conditions, or even when you have acute injuries, like from doing sports or athletes competing. Even in that kind of case, now I realize using the 6 principles from the ancient practices actually have way better outcome in many cases than just going into steroid injection, surgery, all these other Western approaches.
Yeah. Wow, beautifully put. And I want to dive now into those 6 principles because I really think that they are the foundation, right?
Yes.
And you say, 6 principles for natural longevity.
Yes. So it's all natural. It's not like we're trying to just use, oh, if you have high blood pressure, let's take this blood pressure medication. Oh, if this one doesn't work, like switch to the other one. And then also a lot of medications cause other side effects, giving you more problems.
Yeah, absolutely. And are you ready to share those 6 principles with us?
Sure. So number 1 is we need to recognize our body's constitution, because every body is different. You cannot use one size fits all for any condition. And of course, there's the generalization of certain condition, like if you have high blood pressure, then generally people would have certain liver condition that's causing the blood pressure issue. That's in the Chinese medicine terminology, because in Western medicine, they would not think your blood pressure problem is caused by the liver. So if once you recognize your body's constitution, that's when you can address each person uniquely and then design a customized approach to your whole health and longevity. And then the second one is, once you recognize the body's constitution, you want to address your imbalance and your any conditions that you need to address as early as possible. So this is something that is not very well communicated to most people in the Western community, because in Western medicine, we only wait till the symptoms arise and already so severe, then we start thinking, oh, we need to do something. But a lot of times, before you even have, say, high blood pressure or diabetes, your body already has the imbalances in the past 20 years to develop into these conditions. And most people, they don't understand, certain predisposition in your body that goes to your body's constitution again can lead make you more prone to developing certain conditions. But that is not like 100% causative effect. So that's why even like people with genetic conditions, except really some very specific studied genetic conditions like sickle cell anemia or some other conditions, we know exactly, like Down syndrome, this is exactly the gene that causing, or certain, if you have extra chromosome that's causing these conditions. Most conditions like we have studied that has some genetic composition in it, it's only like if you have this gene, you have higher probability of developing certain conditions. Even like breast cancer genes, if you have BRCA2, BRCA1, that only says you have higher probability than normal population in developing breast cancer, but not 100% you will get breast cancer. So that's when we need to recognize the early prevention part. That's when we need to address your early imbalance as early as possible. And you don't want to wait until the fire already starts to dig the well thinking, I really need to put out the fire. And then that's a little bit late. But in my book, I also talked about it's never too early, it's never too late. So even people say, is it too late for me to start doing anything? It's never too late. So the best time to plant a tree was 20 years ago. But if you didn't do that 20 years ago, the next best time is now. So that's the second principle. And then the third principle is that we need to treat the root cause of the condition instead of just treating the symptoms. So once you recognize your body's constitution and you try to do the early prevention as soon as possible, then you need to treat the root cause. You cannot just say, if I develop this diabetes, then I'm just going to use medication to control my blood sugar. Instead, you're now looking at your dietary habits, your other lifestyle that actually can change a lot of things, even like for a lot of other conditions like blood pressure, even cholesterol. For most people, if you tend to have the family history of developing into these conditions, but if you treat the root cause, you can actually avert this predisposition, then you would not have the condition developing in your late ages, like 50s, 60s. So a good example is my mom. My mom actually, like I mentioned, my grandmother, who's my mom's mother, the whole family, all her siblings, her parents, all of them had type 2 diabetes later in their life. So my mom actually has the same genetic predisposition. And when my mom reached her 50s, she actually started having all the symptoms that would also lead to eventually developing type 2 diabetes. But that's when I started telling her, you needed to do all these different things and also taking some herbal formulas so that we're addressing the root cause of her predisposition to diabetes, to high cholesterol, to a lot of other symptoms. Then we are addressing the root cause. So my mom now is 81 years old and she doesn't have any diabetes and she's not on any medication. She doesn't need to take blood pressure medication, no cholesterol medication. But in her 50s, she actually did have high cholesterol.
Wow. Wow. And it's true. It's amazing. The more that we listen to the body, that we respect it, right? You're talking about the gardening of it, right? The more that we nurture that, that is that natural longevity, the healthier, I say the health span, right? That's the new kind of buzzword going around, right? It's not just about lifespan, it's about health span.
Yeah, so that leads to the fourth principle, which is tend your body like a garden. Because in Western medicine, we look at human body as a machine. So, okay, if you break this elbow, let's fix it. If you have knee problem, osteoarthritis, let's just replace it with a titanium joint. But the human body actually is an intricate, interconnected system, not just as its own, but also it's connected to the universe. So that's the other part about, as human body, we're not isolated from our environment and also the universal energy. So that's the other part that we want to talk about, is more like you need to connect your body to the nature, to the universal energy. That's how your body can be in harmony with the universe and the earth, because the human body is the conduit between the universe and the earth. So tend the body like a garden is like you look at your body as a garden, and you have to address the issues in the garden that may not be even related to the particular parts. Like, say, if this plant doesn't grow in this garden in this area well, the
Mhm.
problem may be the irrigation system that is clogged far away from the area where you are showing up the symptoms. So then you need to address the blockage in the whole garden system, not just addressing the the area that shows up the symptoms, like the plant is not growing well.
Yeah,
Then from
that's
there, we
important.
go to the fifth principle, which is actually you follow the natural rhythm. And that is more about connecting your body to the nature, and you need to recognize the natural flow. So everything has ebbs and flow. You cannot try to force something to happen when the time and the environment is not right. And when you try to do that to force it to happen, that's when you're going to do damage to your body physically and mentally. So then from there, the sixth principle is about we need to address everything holistically, combining all the approaches we have to address each individual body uniquely. So that's when we need to combine all the approaches that's suitable for this particular person, for the different conditions this person has. And of course, over time, this also changes. So you need to address things differently at different time of the year, at different period of your life. You know, when you do things in your 20s, that's different from how you address your health in your 40s and 50s. So we just
Yeah.
cannot follow one simple procedure. Everybody takes this medication, or even like some biohacking methods. They say, everybody should take this rapamycin, and then we can help prolong the life. It doesn't work that way. So everybody has to look at their own body. So that's the sixth principle. If this episode has been valuable for you in any way, please leave a review or a comment. It really helps more people to find more reliable, research-backed information in the space that's occupied with a lot of noise.
Again, like there's so much in there that you can literally use to guide that path, right? That route, and that how we take care of ourselves from all aspects. And I love that you kind of stated, we are the conduit between the earth and the universe. Because I feel like sometimes, we forget about that energetic connection.
Exactly. So, a lot of times when people think human is the ultimate power, we can do anything we want. And that's not true, because we're part of the whole universe. So you have to follow the natural universal law. You cannot override the law. Doesn't matter what kind of religious belief, or even you're atheist, we have to recognize there's actually a higher power than human being in this universe.
Yeah, absolutely. Well, and I want to dive in a little bit, and I'm super interested because this is something that I haven't dove into. But you talked about stem cell therapy, right? Bringing that kind of regenerative therapy into, the traditional Chinese medicine realm, and really honing that together and saying there's so much that we can do. Can we dive a little bit into that? How did you get started with stem cell therapy? Let's start there.
Okay. So I actually did not know anything about stem cell therapy until around 2020. So
Hmm.
before that, I was mostly into this world of 6 principles. And actually, the six
Yeah.
principles I only formulated when I started writing this book about 1.5 years ago. So I was practicing these principles myself, even teaching my mom and my patients, but I never really had it articulated this well until I started working on the book. And then going into stem cells, I was basically introduced into stem cells by accident because
Oh.
I already had my retreat in Colombia. My
Mhm.
idea of having the retreat is actually to connect our body to the nature better. And I feel my body gets more energy from the nature when I'm in Colombia. I also
Mhm.
feel the flow of my energy in my body is much better than when I was in Boston or in some other parts of the world, because somehow the air, the energy in Colombia just give me this lift every time I comes here, even now, because I've been coming here
Wow.
for 8 years. So,
Yeah.
but then by accident, I was introduced into this lab in Colombia, and they grow stem cells from the umbilical cord. So from
Really?
there, yeah. So from there, I realized, and I went to their lab twice. I even went into their tissue culture room to look at how they do all these things. And because of my background in pathology, so I know how to do all these things. And I observed like how they strictly follow the procedure, the protocol to keep everything clean, to have no contamination in the stem cells they use, and also all the scientific evidence I read over time since I got connected with them. So that's how I started looking into
Mm.
this, because before that, I really did not know there's such a thing. And I also realized there's limitation even in Chinese medicine in treating aging-related conditions. So a good
Got it.
example is my mom again.
Mhm.
So my mom actually was the first patient to receive stem cell treatment from me.
Oh, okay.
And she really had some kind of condition in her leg, which is called lipodermatosclerosis, that
Mhm.
she developed around 2020 in one of her leg, that over time, by 2021, that leg was very inflamed and she had a lot of pain 24 hours a day, all the time. Sometimes the pain was worse, sometimes it was less. And we were trying to use acupuncture, herbal
Yeah.
medicine, different things to see whether it can alleviate that symptoms, because she really suffers a lot of pain in the leg. Nothing really worked very well. So then I studied, did more research about what can we do to solve this problem. And I found out this condition, if not treated properly, eventually would develop into ulcer and amputation. And right around
Mm.
that time, I also had a patient of mine whose mother was in her 90s, and her mother had diabetes too. So then
Mhm.
her mother actually had similar condition like my mother's leg. And then her mother eventually had amputation. So I didn't want my mother to go that route. And then I looked into what Western medicine treatment can offer for this kind of condition. Most times, like my patient's mom, she even tried some kind of experimental stem cell treatment in Boston. And then after that, she tried stent treatment. They actually inserted stent into her vein because they think
Mm.
this problem is caused by vein insufficiency in the lower leg. So, but all those things didn't really work for her. So eventually she had amputation. So my mother, I think also because she had this predisposition to diabetes from her family history that I mentioned at the beginning. So I think this is also part of her, uh, the symptoms of her predisposition to diabetes. So I thought, okay, since there are no effective treatment in Western medicine for this, let's try something different. So right around that time, I was introduced to this stem cell lab in Colombia.
Mhm.
Then I also studied thinking, stem cells are very good at reducing inflammation. And what this kind of condition is, doesn't matter what caused it, it's actually the chronic inflammation in the lower leg. So I was thinking, maybe we can try to use stem cells to reduce the inflammation. Then she would not have this much pain. And also, once the inflammation is reduced, she probably would not need to go down the route of having ulcer and amputation. So we
Yeah.
tried it with the stem cells from this lab in Colombia on her. Within a month, her pain in the leg was gone. So
Wow.
it's amazing. And then again, we tried a lot of other things, including Chinese medicine, and didn't really give her that good result. So that's when I realized actually the stem cells are very powerful, and also they are not really an isolated pharmaceutical ingredient. They're actually a combination of different subgroups of cells from the umbilical cord. So it's more or less like some sort of holistic combination in Chinese medicine. And on top of that, in Chinese herbal medicine, we actually use dried up placenta to
Mm.
heal a lot of people with very deficient body, very sick for a long time. You use the placenta to help boost their energy. So it's not,
Mhm.
the idea is not new, but because we have this better technology to isolate stem cells now to get huge quantities that were not possible thousands of years ago. So it has more powerful clinical application to treat conditions that even Chinese medicine have not had good results for. So that's how I started my stem cell clinic journey.
Wow. Well, and what an inspiring story. I reference my mother a lot as well in a lot of my talks, and she's a little older. My mother's 87, but same type of thing, right? Because we're just trying to make sure that they're as healthy as possible, and we learn from experience that way too.
And also I feel, since our parents now are in the age that needs a lot of care, they are declining. Because also for my mother, she was born with a lot of deficiencies. So I witness a lot of people I know, like they become caregivers to their elderly parents that really
Right.
are a big burden for them because they also need to take care of their kids. At the same time, they have to take care of their elderly parents. And then they have a lot of other things too in their life as well. So it's very stressful.
Yeah.
And then at some point, sometimes they cannot take care of their parents anymore. Then their parents just go to the nursing home and decline there. So I really don't want my mother to go down that route, even though she had a lot of deficiency. So I feel since 2021, she has been having stem cell treatment about twice a year. And then
Mm.
even though with all the deficiencies, osteoporosis, very severe osteoporosis, my mom right now, she can still live independently. So I feel
Amazing.
that's really what should be the option for most people, because that actually can release a lot of societal burden taking care of elderly people. And
Mhm.
our society is also an aging society. So if we really want our society to uh, be really for elder people, they can actually take care of themselves, and then they don't burden the society for the caregiving they need, then they can live healthier, longer with vitality. That's actually the ultimate goal. It's not like we just want to extend people's um, lifespan, and we want them to
Yeah.
be able to enjoy the life, not having all the pains and not just having dementia sitting in the nursing home.
Yeah, absolutely. What and talking about stem cell therapy, you obviously have a way to decide, when it would be administered, how often, things like that. What would people go through for that process? Just if they decided to go down this road or had something that was ailing them, what would you say to that?
So usually when people looking into stem cells, they already have certain conditions. A lot of them
Mhm.
actually are now early stage, like I wanted to teach people to do. However, even though you are already at the like stage 4 of osteoarthritis of the knee,
Mhm.
stem cells can still help tremendously, and then you may now need to do the knee replacement. So,
Yeah.
so initially, most people looking into stem cell treatments, they are actually on their own. They are now told by their doctors because I would say even nowadays, more than 80% of doctors, they are still not very open to stem cell treatment because they think it's
Mm.
unproven. It's not scientifically proven, even though there are so many research all over the world, they still think it's not well studied. So a lot of people contacting any clinic doing stem cells, they are really doing their own research, and then they read about it. Then they want to find out what it is, and then they try to educate themselves. So, and then what we do here at Stem Cell Therapy Experts, we actually
Mhm.
first set up a complimentary consultation. Usually it takes about 30 minutes to 45 minutes. Then we
Mhm.
have to understand your whole body. That goes to the principle about you recognize your body's constitution, treating the root cause. Because we need to understand what you're looking for help with. Even like say you're just looking to treat your shoulder because you haven't been able to move your shoulder for the past year because of the frozen shoulder.
Mhm.
Sometimes the problem is not just a frozen shoulder. You may also have other things going on inside your body that's causing the chronic inflammation not healing itself. So we have to go through the consultation. Then we understand the whole body conditions. Then we will give people recommendation, what we can do with the stem cells or even combining stem cells with many other therapies we offer like acupuncture, herbal medicine, red light therapy, uh, radio frequency therapy, or even like NAD injections. All these things, we have to
Mhm.
combine them together to help reduce the inflammation and help whatever condition they're looking for help with. So a lot of times after the initial consultation, sometimes some people they say, okay, I'll do more research, I'll think about it. So some people they may go ask their own uh, primary doctors or even their rheumatologist or orthopedic doctors. And then sometimes they are
Yeah.
influenced by what the doctors tell them too. So sometimes they're told, oh, don't even go that route. It's not proven. You're better off just do steroid injection, or you will need knee replacement anyway. So just do it. So then
Right.
there's another process, like for people to think, whether they're going to follow what other people told them, or including their doctors, or they're going to do their own research to find out what's the best route for themselves. So then after that, there's another maybe less than 50% of people, they will decide, okay, I'm going to do this because I believe this will help me more than the surgery or the medication.
Yeah. Well, and what would you say? Because, I'm always curious. And then whenever I hear about something, I'm like, oh, like maybe I need that, right? That might be something that, so your goal, or I take back goal, maybe not a goal, but you had said, a lot of times when people are searching for stem cell therapy, they already have a problem, an injury, or a condition, right?
Yeah.
What about the people who don't?
Okay. So that's another subgroup of people who are into health, longevity, and they're very healthy. I think you fall into that category too, right? So,
That's why I asked the question.
so for example, I don't have a lot of problem either. The only problem I have would be I have a ACL tear in my left knee.
Mm.
That was
Yep.
from like 15 years ago, but I don't know whether at that time I did complete tear or partial tear, but after that, I also injured that knee several times. So eventually
Yeah.
I felt knee instability, but I never did any ACL repair surgery. So since I started doing stem cells, because I got into close to my 50s year old, so I started
Mm-hmm.
feeling some minor pain in my knee. So I actually did a 3 series of treatment on that particular knee with stem cells.
Mm-hmm.
And then
Mm-hmm.
after that 1 year with 3 treatments, I don't have any pain or I don't feel any knee instability when I try to do hiking. And recently I also hiked Mount Everest. I hiked Kilimanjaro.
Wow.
So no problem.
What? Oh my
So
gosh. That's for
I
another show. We have to talk about that.
Sure. So for me, I don't have any other problem and I take care of myself pretty well. And I really want to live to whatever age my body allows.
Yep.
I don't want to be bedridden. I don't want to have any chronic conditions. That's my goal. Uh, so what I've been doing since 2021 is that I actually get stem cell infusions myself,
Mm-hmm.
around maybe 3 to 4 times a year too. So I've
Nice.
been doing that. I also did my knee 3 years ago. And then recently I did it again because I started feeling a tiny bit of pain when I climbed the ladder to do things.
Mm.
So again, stem cell, even though it's very powerful, even for people who are aging, and I just turned 50 about 5 months ago. So
Mm-hmm.
I still need to keep maintaining my body because we always develop more chronic inflammation. That's just the natural process, the natural aging process. We cannot change that. So, but
Yeah.
what we can do is to make the chronic inflammation not as bad so that we don't have a lot of symptoms showing as the result of the chronic inflammation. So that's why I myself, I'm also doing these type of treatments. If you
Mm-hmm.
can afford doing this, of course, it's not
Mm-hmm.
some cheap procedure, but if you have the capability of doing this, say once a year or once every 2 years,
Mm-hmm.
even though you don't have a lot of chronic conditions or any autoimmune condition or any severe conditions, you can still benefit from it. And my own feeling or my own experience with it is I actually feel I have more energy. And also I
Mm.
feel for other treatment I do, like say red light or NAD injection or whatever supplement I take, I feel it actually, the the stem cell actually gives your body a jump start. And then all the other healthy lifestyles or longevity practices you do is to enhance the effects of the stem cells. And also, actually, the main goal is to stimulate your own body stem cells to do the repair and then to regenerate better. So that's why my book is called Regeneration Effect, because everything is about regeneration. And we age
Mm-hmm.
is because our regeneration capability declines with aging.
Yeah. And so I want to talk about that too before we sign off, because this is something that inspired you to write that book,
Yes.
right? Because it's called Regeneration Effect: Sacred Wisdom for Staying Young.
Yes. So
Love
because
it. Love it.
I actually came about the idea about writing this book after I started doing stem cell treatment. And then I realized sometimes people still in their mind, they think, oh, if I do this stem cell, it's going to be a magic bullet. It will fix everything I have. That's not true, because stem cells are the jump start, like the jump start for your car, but
Mm-hmm.
it's not going to fix everything. You still have to follow a lot of different practices for your health and longevity. So if your body is aging naturally, if you use a jump start, it will give your body a boost in the energy, then to help your body to regenerate better. But for that to happen, you have to follow a lot of other holistic principles in the book to address everything. And the stem cell is not a magic fix. So that's why I decided, okay, I need to write this book to combine the ancient principles with the stem cell or other modern technologies to teach people that, you have to do all these other things to make the environment for the stem cell treatment to work. It's not like the stem
Yeah.
cell, you just get one treatment, then it takes care of everything for the rest of your life. It doesn't happen that way.
Yeah. Yeah. Well, and I think we get into that, right? We want that magic thing that's going to help reverse everything and we don't have to do any work. That's
Yeah,
just not realistic.
exactly. That's again
Right.
goes to the, the traditional thinking of Western medicine. Oh, if I have this problem, I just take this pill, do this surgery, then it takes care of it. It's still that a lot of people still think that way.
Yeah. Yeah. No, we definitely have to do the work if we want to be reversing aging and slowing things down so that we are able to do more at older ages.
Yeah.
So, wow, such great information. And like I said, I was very, very selfish asking that question about, about what if we don't have anything. So yeah, so I am going to end it there because I want to make sure I'm keeping track of time. But we have to have you back because I want to hear all about Mount Everest. I want to hear about Kilimanjaro. Those are amazing feats that you have shared, and I want to talk more about that and dive more into some of the other therapies that you've presented here too.
Sure. I would love to be on this show again talking about
Amazing.
what I can share with people because I feel my job is to convey the idea that I want to promote. Actually, even 25 years ago, when I started my clinic in Boston, I wanted to help people live healthier and longer and also want to promote the idea of early prevention. But then I just
Yeah.
realized during the practice, most people they don't think things that way. And even nowadays, with all the modern technology, we can really help slow down aging with so many different ways. People still think, oh, I should just do this. When I have this problem, I just take this pill, do the surgery, then it will be a magic fix. And then they think
Yeah.
stem cell is the same way. So I really want to convey this kind of concept and then so that people can incorporate this six principles into their daily practice. That's actually the ultimate goal. I think that will
Yeah.
benefit everybody.
Amazing. Amazing. And tell me a little bit too, just quickly, the Zenerchi retreat in Colombia. How do people like they just need to go to Colombia and visit and go? How do they get there? What do they do? What happens? Tell me.
So initially, before I started doing stem cells, most people coming here, they were just looking for relaxation, meditation,
Yeah.
connecting to
Mhm.
nature. So that's that type of retreat I was envisioning before I knew anything about stem cells. So now,
Yeah.
because I started offering stem cells 5 years ago, so now mostly people coming here, they come here to do stem cell treatment. And at the same time, after stem cell treatment, like I said, we need to combine a lot of other treatment together to make the stem cell work better, having the good environment for the stem cells to do the repair, to stimulate your own body's regeneration. So some people, they would stay here for a week to a month. So recently
Mhm.
we had a gentleman from Ireland. He actually came
Oh,
here and stayed here for a whole month for his
amazing.
hearing problem. He actually had a chronic ear problem that's
Mhm.
somewhat related to autoimmune conditions. So he had 3 treatments during the 1 month stay with stem cells. And along that time, we also gave him acupuncture, herbal medicine, red light therapy, some IV therapy. So he
Mhm.
had a whole package and he stayed here for a month. So depending on,
That's
what you're
amazing.
looking for.
Yeah. Oh, that's amazing. Amazing. All right. Well, thank you so much, Dr. Song, for being here, for sharing all that amazing wisdom and the things that you've learned and what you're sharing and helping people. It's just great.
I'm so happy that you had me in this interview so that I can tell people about all these principles I always want to people to understand and also integrate into their daily life. So that's why for the 6 principles, I even have 6 pamphlets. So it's very easy for people to understand. They don't have to read the
Yeah.
whole 400-page book to understand. So,
Love that.
and I'm
Love that.
actually giving out them to your listeners for free if they are interested.
Love.
So
So
they can,
yeah, so we'll have all that information in the description for them to take advantage of that. Thank you.
exactly. Yes.
Yeah. So take advantage of that. I can't stress that enough. The 6 principles I think are genius. So take advantage of those downloads so that you can follow, start to implement them into your daily practice if this is something that you want to do. And who doesn't want to have a better and longer health span to be able to live the way you want to live for as long as possible? So, for those of you watching, thank you for tuning in. Make sure you give this episode a like and leave some comments.